let's be real. Some USMLE questions are just brutal. You think you've studied everything and then bam, they throw you a curveball that makes you question your entire existence. Today, we are going to be looking at some of the hardest questions on the USMLE. And more importantly, I'm going to be showing you exactly how to outsmart them on the exam day. The first type of question is the two-step thinking trap. I call it two-step thinking trap. You can call it the second order questions. The USMLE loves to give you questions you think you know. You're reading the vignette, it looks like you know what's going on here. And then they ask you a question on a very sneaky second layer that you may not consider. There are three types of questions usually on the USMLE. First order questions, which many students are comfortable with. And of course, I tell my students, 80% of your questions on the USMLE will probably be first order questions. You read the vignette, you make the diagnosis. But there are those second order questions where you are reading the vignette, you think you know what is going on, and then there's a sneaky second layer to the question that makes you basically lose your mind and maybe fail the questions most of the time. We'll see an example of this. All right, let's look at this question right here. A 22-year-old man is brought to the emergency department 10 minutes after falling down a flight of stairs. Look at that. If you've been watching all the videos I've been posting at this point, you've learned. Don't read past the first line without trying to make some sense of the vignette. Okay, 22-year-old man is brought to the emergency department 10 minutes after falling down a flight of stairs. You're asking yourself, why will a 22-year-old fall down a flight of stairs? If they are giving you this, you could say, oh, maybe he slipped and fell. No, not on your exam. On your exam, you don't just say he slipped and fell. Something is wrong that caused him to fall. Is it a neurological problem, for example? Or whatever it is, right? An x-ray of the right wrist shows a distal radius fracture. You see it beginning to look like an anatomy question, right? You're thinking to yourself, maybe this is some kind of anatomy question. Okay, he has fracture of his radius. A rapidly acting IV anesthetic agent is administered. Okay, they gave him anesthetic agent and closed reduction of the fracture is performed. Following the procedure, the patient reports palpitations and says that he experienced an extremely vivid dream in which he felt disconnected from himself and his surroundings. So if he felt disconnected from himself and his surroundings, what do we call that? I hope you said hallucination. So you start asking yourself immediately, wait a second, I thought this was going to be an anatomy question on maybe what the radius is fractured, what type of fracture is it, or what other structure has been damaged. Maybe it's going to be about one of your wrist bones or something of this nature. But quickly you realize, wait, after they mentioned IV anesthetic agent being administered to this patient, they are now telling you he experienced palpitations, vivid dream. You have to start asking yourself, why did he experience palpitations and vivid dreams? This is how you interpret vignettes, right? Disconnected from himself and his surroundings, he's having hallucinations while under anesthesia. So clearly we can conclude that his anesthetic agent is what is causing this presentation. His pulse is this, blood pressure is high, pulse is increased, of course, blood pressure is elevated. The patient was most likely administered a drug that permanently blocks the effect of which of the following neurotransmitters. Here you see a question that starts out almost, okay, he fell, he fractured something. It looks like they're going to ask you an anatomical question. We are now talking about a local, an anesthetic agent rather. And now they're asking you essentially for the mechanism of action of this anesthetic agent. This is the kind of vignette I would say that when many students encounter them, you don't even know what is going on at some point any longer. If you know this type of question, you're asking yourself already, okay, which anesthetic agent is going to cause a patient to have palpitations, vivid dreams, hallucinations? Which anesthetic agent will cause that? And then, okay, you have to tell yourself, did you think of the answer? If you thought of the answer, put it down in the comment and I'm going to see it. But the anesthetic agent here is actually ketamine. And this is one of the important side effects of ketamine they want you to know on your exam. Of course, ketamine will cause hallucination. And it will also cause sympathetic activity, increased sympathetic activity. Now, how does ketamine work? Ketamine works on the glutamate receptors. Ketamine works on the glutamate receptor. You can see a classic example. This is a question my student failed. So I'm giving you a question that's literally out there. A student of mine failed this question, and it was the perfect example to use to show you how you can start out reading a vignette. You think it's one thing they're talking about, and by the time you get to the end of the vignette, they're asking you a whole different thing. A lot of students get confused with this type of questions, and you can easily fail this question. The way to make sure you avoid this type of problem is when you read the vignettes, you have to interpret line by line. You have to ask, why is this happening? Why is this happening? The patient fell. Why did he fall? Okay, maybe that there's not too much we can make out of that. He fractured his wrist. Okay, they gave him an anesthetic agent. Okay, and then he's now having palpitations. Oh, maybe the anesthetic agent caused the palpitation. Why is he having palpitation? You're answering these questions as you go. You're interpreting the vignette line by line. By the time you get to the end of it, you will not make a mistake. Did you get this question correct, by the way? Let me know in the comments. Hardest question number 2 is the zebra diagnosis distraction. Now, what are zebra questions? Zebra questions, the phrase zebra questions come from a very common teaching aphorism in medicine, where they tell you that if you hear hoofbeats, you should think about horses, not zebras. Even if zebras technically also have hoofs and may sound like horses. Big point of that is basically that common things are going to occur commonly. And on your exam, you're also going to see more common things on the exam frequently. But from time to time, the USMLE is going to give you a zebra to see if you understand and if you paid attention to some of those additional differentials, some of those additional concepts that we often consider low yield. And we'll see an example of this in the next question. A 2-year-old boy is brought to the pediatrician for evaluation of delayed walking and frequent falls. Delayed walking and frequent falls, right there you go. What is that? You're not sure. Why is he having delayed walking? Why is he having frequent falls? You're supposed to start thinking of differential diagnosis. Some of you may be thinking of Duchenne muscular dystrophy, maybe myotonic dystrophy. You're thinking of something, right? Why will a child have delayed walking and frequent falls? His parents also report that he doesn't speak much. He doesn't really walk properly. He falls a lot. He doesn't speak a lot. Some of you may even be considering autism. This is all appropriate. As you read the vignette, you are supposed to be thinking of possible differentials. Now, we want to go quickly, so we won't spend all the time breaking down questions here. And he seems unusually happy all the time. Unusually happy all the time. Did that click for you? Did that make you think of a differential? Did that make you think of a diagnosis immediately? I hope it did. I won't spoil it, so let's just keep going. He's often laughing spontaneously. Happy all the time, laughing spontaneously. On physical exam, the child has wide-based gait, jerky arm movement, and inappropriate bouts of laughter. Wide-based gait, jerky arm movement, you can call that ataxia, plus inappropriate laughter. If I give you a child with ataxia and inappropriate bouts of laughter, you should already tell me what the diagnosis is here. But let's get to the end. He's noted to have fair skin and light-colored hair. His older sister is healthy and developing normally. Genetic testing reveals a microdeletion on maternal chromosome 15. If I asked you, what is the most likely diagnosis, what would you say? If you said Williams syndrome, I think it's called Williams-Bauer syndrome, but doesn't matter for step 1. Some of you may think Williams syndrome. People with Williams syndrome tend to be friendly. But here, ataxia plus inappropriate laughter and a deletion on chromosome 15 is what you have in Angelman syndrome. Angelman syndrome. Do you remember the brother of Angelman syndrome? What's the other disease? The other disorder that is also as a result of a problem on chromosome 15, probably paternal deletion. I hope you said Prader-Willi syndrome. What would the answer to this question be? The answer, I've already given it to you. Angelman syndrome, Which of these? Do you think it's a trinucleotide expansion repeat? That would be my tonic dystrophy. Do you think it's an imprinting defect? Do you think it's a nonsense mutation in a tumor suppressor gene? Do you think it's uniparental disomy or mitochondrial inheritance? Let me know what you picked as an answer down in the comments. But this is an example of how they would ask you a question on something that is not frequently tested, right? The last time you saw a question on Angelman syndrome is probably when you studied biochemistry and genetics, or when you reviewed genetics. So many times students don't think of these kind of differentials a lot. There are a number of things on your USMLE step 1 that they don't ask a lot, but when they ask it, if you know it, you'll be glad you remembered it. Things like maple syrup urine disease. You often see questions on maple syrup urine disease when you study biochemistry. You see it in the Q bank. They give you a child, a newborn with sweet smelling urine, for example. It's rare, they don't ask it all the time, but when they ask it, they want you to remember branched chain keto acid dehydrogenase, for example. That's the kind of presentation they would give you that is kind of rare, but they can also test it, right? Maple syrup urine disease, not all the time, not frequently tested, but it can be tested very much. So sweet smelling urine in a neonate, you need to know that that is maple syrup urine disease. For example, branched chain keto acid dehydrogenase. They can give you a child or even an adolescent, a person with dark urine with arthritis. Dark urine and arthritis. What would that be? I'll let you know. The enzyme that is deficient here is homogentisic acid oxidase. I hope you said acaptonuria. Again, acaptonuria is one of those things. They're like zebras. They are not the most commonly tested things, but they can be tested. And your exam wants you to remember it. If I give you a vignette on a young child with abnormal behavior or changes in their behavior and neurological decline, a young child, especially a young boy with behavioral changes and neurological decline, what would the most likely diagnosis be? If you said neonatal adrenoleukodystrophy, you would be correct. Again, it's one of the paroxysmal disorders, you remember. It is rarely tested, but when they test it, they want you to recognize it. They can give you someone with pellagra-like rash with neutral aminoaciduria. Pellagra-like rash with neutral aminoaciduria. What would the diagnosis be? I hope you said Hartnupp's disease. Again, Hartnupp's disease is one of those things that don't show up all the time, right? They are one of those things that don't show up all the time, but when they ask it on your exam, they are zebras. They want you to remember them. By the way, what causes Hartnupp disease? What causes Hartnupp disease? Abnormal transportation of what amino acid? Tryptophan. Very good. Tryptophan. Which other one can I think about? Orotic aciduria as well. Orotic aciduria, when they give you a neonate with failure to thrive, megaloblastic anemia, and unresponsive to B12 and folate. A neonate that has failure to thrive, has megaloblastic anemia, and is unresponsive to B12 and folate. You should immediately think this might be a situation where we have a child with orotic aciduria. And what do they want you to remember? Your pyrimidine synthesis pathway. So these are examples of diseases I would consider zebras. That they're not tested all the time. Sometimes you don't even see them unless you study specific things, like you're doing biochemistry and genetics. You're going to see those diseases. But for the most part, you don't encounter them. And then when you encounter them, they need you to remember them. Pay attention to that. And what did you pick as the answer to this question? Let me know in the comment. I'll just let you know. The answer here is going to be B. Did you get it correct? Hard question number 3 is the weird lab values question. Have you ever seen a USMLE question where they dump like 10 lab values on you and you're supposed to interpret, you're supposed to know what the answer is? Sometimes when students come to me and they tell me, Kennedy, especially step 2 CK students these days, I want to score a 250, I want to score a 260 on my exam. I'm already scoring above 240 or around 240. I tell them, if I give you just the labs, are you able to reach the diagnosis? For example, that's the kind of question students at that level will need to be able to answer. There are times when even for your step 1, where it is just pass or fail, they give you some of those questions where you really need to be able to interpret the lab values properly for you to correctly answer the questions. And for some students out there, this is one of the most challenging types of questions you will face. The solution here to these questions on labs is to identify what's high, what is low, how do they relate with one another. You want to use very quick associations. You want to know things like, if I give you low calcium and high parathyroid hormone, for example, you immediately think this is secondary hyperparathyroidism and all of those kind of things, right? If you stick to what changes each lab value reflects, you're hardly going to be making mistakes, right? For example, if creatinine is elevated, it indicates that the kidney may be failing. If CKMB is elevated, it indicates that there's a myocardial infarction, for example, and so on and so forth. So you basically know if this change is occurring to the lab value, this organ in the body is probably having a problem. That correlation makes it easy for you to break down these labs values and make sense of what the question is asking you about. The USMLE loves lab values, but it's at the end of the day, it's still really a concept test. So you're going to need to zoom out, right? Recognize the patterns and think logically every single time you try to answer the question. No guesses. Hard question number 4 are the super long clinical vignettes. Have you seen those very lengthy vignettes that by the time you get to the middle of the vignette, you've forgotten everything you read at the first part of the vignette, right? They're super long. You're reading the vignette and you zone out. You're reading some lines twice, for example, because the vignette is simply too long. I don't like them myself. I find them exhausting. Luckily, we don't have too many of them on the exams, but we'll look at one example at least. Now take a look at this question. The moment you look at this question, your heart sinks. This is so lengthy that if you even begin reading it, you immediately begin feeling sleepy. I'm not going to be answering this question for you guys. I'm going to give you a very quick scroll. Maybe I would read it slowly for some of you so that you'll be able to try to attempt it. But I would need you to try to follow along with this question, think about it, and try to come up with the correct answer. Let me know in the comment. If you answer this correctly, I will find your comment and I will personally respond to you. A 41-year-old man is brought to the emergency department by his wife because of increasing confusion, difficulty concentrating, and generalized weakness. You should pause and come up with an idea what you think is going on. Over the past 3 months, she has noticed that he had become increasingly irritable, has trouble sleeping, and often seems to be in a fog. He has also been more forgetful, often misplacing things or repeating himself in conversation. Over the past few weeks, he has reported episodes of muscle cramps and tingling in his hands and feet. He also says that bright lights have been giving him headaches. He has a history of alcohol use disorder with multiple failed attempts at sobriety. He drinks approximately 1 pint of vodka daily and eats very little. He was recently fired from his job due to repeated tardiness and outbursts of anger. He does not take any medications regularly and has no known drug allergies. There is no family history of neurologic or psychiatric disease. On physical exam, the patient appears thin and disheveled. He is oriented to name but not time or place. His affect is flat. Neurologic exam reveals decreased vibratory sense in both lower extremities and diminished reflexes at the ankles. He has a positive Romberg sign. His skin is dry and his mucous membranes appear pale. There is a mild resting tremor in both hands. He is noted to be icteric. The abdomen is distended with a fluid wave and spider angiomas are visible on the chest. Lab studies show hemoglobin 9.8, MCV is 110, platelets 98,000, AST 85, ALT 42, ALP 210, total bilirubin is 3.6, serum sodium is 130, potassium is 3.2, magnesium is 1.1, serum calcium is 7.4, glucose is 58, albumin is 2.4, and PT-INR ratio or PT-INR generally is 18.2 seconds and 1.8. Which of the following is the most likely primary contributor to this patient's current neurologic symptoms? What is the correct answer? You can pause, go back, try to get this question correct. Look at that. Look at that. Look how long this question is. These are some of the most intimidating. But once again, interpret the question. You may want to read the last line here. One of the very few times I'm going to tell you to do that. But interpreting the question line by line will help you get the answer correct. If you get the answer correct in the comment, I'll let you know. If you would like to see me do a quick video where I actually break down this question, let me know as well. So for this type of question, once again, you can read the whole thing, or I really want to vomit as I'm saying this. You can read the last line first. This is literally the only place where Kennedy is going to tell you it is okay to read the last line first. For these super long vignettes, you want to know where you are going with reading this question, so that as you read the vignette, you know exactly what to be looking for and paying attention to throughout, from the beginning of the vignette throughout the vignette. The other thing you can do is to scan for the details. Scan for details like the age, the specific symptoms. Why is the patient here right now? Right? And then look for risk factors, of course, in these vignettes. When you have super long vignettes like this, buzzwords may be relevant. There may be phrases here and there that you need to underline in the question that will help you answer the question correctly. All right, let's recap. Here are the 4 hardest USMLE questions and how to outsmart them on your exam day. The first was the 2-step thinking trap. Always ask why, and that will help you arrive at the best next thing, and hopefully the next thing they're going to be asking you on your exam. The second type of question was the zebra diagnosis distraction. You want to remember that common things occur commonly, so stick to the common diseases first. The third were the lab values. Weird lab values causing confusion all over the place. You want to recognize patterns, don't memorize. Recognize patterns, don't memorize. Ask yourself, if this lab goes up, what organ is failing? If that lab goes down, what organ is affected? And the fourth type of question is the super long vignette that exhausts your mind even before you get to the end of it. Again, for this type of question, you want to read the last line first. You want to highlight the most important information from the question. Just scan the question, find the most important details, and many times it will save you a lot of time on your exam, and you'd not be intimidated any longer. Now you're armed with these strategies, you'll never fall for these traps again. Comment below which of these types of questions destroy you the most. Let's talk about them. We'll talk about them in a video like this, or we can talk about them in the next live session we are going to be having. If you found this video helpful, hit the like button and smash that subscribe button as well. Turn on notifications so that you don't miss another high yield tip. Done? Good. Now that we have gotten all of that out of the way, go crush your studies, and I'll see you in the next video.